And the next speaker is Mrs. Niki Pandria from the local developing team, which will present a mobile-friendly vocabulary for ADHD.
Okay, so now it's okay? Okay, so, okay. ADHD stands for the Attention Deficit Hyperactivity Disorder and is defined as a neurobiological disorder. It is 4 times more frequently found in boys than in girls, and it affects approximately the 5% of school-going population. The ADHD tends to be measured by behavior. So therefore, there are a lot of major behavior rating scales that have been developed in order to assess the behavior of the children or the adolescents. So we have the DCM. This is the Diagnostic Statistical Manual of Mental Disorders. Currently, we have the 5th version, that is an update of the previous one, and it is more accurately characterize the affected adults. The symptomatology is the same, but we will discuss it a little bit later in another slide. Also, we have the ICD-10, that is the International Classification System of Mental and Behavioral Disorders. It was created by the World Health Organization, and it characterized the ADHD as a hyperconnected disorder. This term has been used widely in Europe, and also it is included in the European clinical guidelines. Going through to the behavior rating scales, we have the child behavior checklist. That is a very good measure of child's emotional, behavioral, and social aspect of its life. It has been used as a diagnostic tool for various mental and other behavioral problems. It has three main scales and 8 subscales. Also, there are 2 versions, one for the preschoolers and the other for children and adolescents. Also, we have the corners rating scales. We have 3 forms, one for parents, for teachers, and for adolescent self-report form. We have 2 versions, one as a long one containing 6 subscales, and the other is the short one containing 3 subscales. Also, we have the Vanderbilt ADHD Diagnostic Teacher Rating Scale that we used also in our vocabulary. It is a very simple diagnostic tool that contains all the 18 ADHD core symptoms. It is DSM-4 specified, and also it contains some extra symptoms for comorbid conditions such as anxiety, depression, oppositional defiant disorder, and conduct disorder. Also, there is a rating for the child's performance. Also, we have the parents version. This is the version for the parents of the child. It contains also the 18 ADHD core symptoms for ADHD and is DSM-4 specified. It is also includes some extra symptoms such as 8 for oppositional defiant disorder, 12 from the conduct disorder, along with 7 from the pediatric behavior scale. In total, it contains 47 items, as well as extra 8 rating scales for the child's observation. ADHD rating scale. This is also a diagnostic tool that was created based on the DSM-4. It can be used for diagnosis of ADHD and its severity, as well as a measure of treatment response. The ADHD-3. We have also this tool for diagnosis. There are 2 versions, one for parents and the other for school. The SNAP-4. The SNAP was the first behavior rating scale that was developed according to the DSM-3. Now we have the SNAP-4, that is an updated version according to the DSM-4, but it uses a different scoring system compared to the DSM-4. And finally, we have the actors. There are two available forms, one for parents and the other for teachers, each of them containing 24 items and can be used for children and adolescents aged from 6 to 14 years old. Following the evolution of technology, a lot of mobile tools also have been developed for ADHD. We have several of them here. The first one was the ADHD self-assessment quiz developed by Dr. Halloween. It contains some questions in order to understand what is ADHD, along with some information, resources, and next steps. The other is the ADHD psychopharmacology that can help psychiatrists and health professionals to treat and diagnose ADHD with medication. Also, it provides some screening tools also and a scoring system. The psychiatric times and the clinical scales. Also, it was developed for psychiatrists, psychologists, physicians, as well as generally health providers in order to facilitate the observation of the child, having screening tools and scoring system, and also to help them on how to administer a psychiatric test. It includes some scales for most frequently found psychiatric problems, such as bipolar disorder, ADHD, anxiety, depression, autism, and general scales. The ADHD test light, it was scientifically developed in order to help you calculate what's the possibility of having ADHD. And finally, the Psychotic Pocket also is a tool for diagnosis, treatment. It provides some management algorithms, screening tools, and score system. And it has great coverage in a lot of psychiatric problems, such as mood disorders, personality disorders, ADHD, dementia, Alzheimer's, and others. So after all these traditional tools that we have, along with the modern tool that we have for ADHD, what was the need for designing a new vocabulary? First of all, the existing tools for screening and/or diagnosing ADHD have been developed following a multi-level approach. Therefore, they have a lot of levels, such as attentional problems, hyperactivity, and impulsivity. Also, we mentioned that the assessment and the measurement of ADHD is based on behavior assessment. So the behavior assessment is subjective. Therefore, there is a need for a mobile tool in order to record the behavior when it occurs, minimizing the risk both for subjectivity and information loss. And finally, we should also mention that ADHD is very difficult to be found as a pure condition. Also, other conditions such as anxiety, depression, conduct and oppositional defiant disorder, learning disabilities, and antisocial activity expressed by aggression and rule breaking are very comorbid situations. So, the rationale of our mobile-friendly ADHD vocabulary could be summed up to the following goals. First of all, we want to create a list of a minimum number of ADHD symptoms to facilitate the child's observation in different and multiple interaction cycles, to improve parents, teachers, and skills of observation, and finally to help clinicians and health professionals to have a more objective description of child's behavior. So we created our vocabulary following a three-step procedure. First of all, we revisited the literature in order to collect the most possible ADHD symptoms in a table format, and subsequently we selected 3 diagnostic tools. That was the DSM-4, the ICD-10, and the Vanderbilt ADHD Diagnostic Teacher Rating Scale. We isolated the common symptomatology of all 3 tools, adding some extra symptoms from anxiety, depression, conduct disorder, and oppositional defiant disorder that also they are more frequently to be found as a comorbid conditions. And finally, we created a mobile-friendly item, mobile-friendly vocabulary containing 25 items that is suitable for mobile devices. So let's say a word about the diagnostic measure that we used. First of all, we know that DSM-4 and ICD-10 are the most widely used measures for ADHD, but they have different scoring systems during the diagnosis process. First of all, in ICD-10, we should have 6 symptoms from the table A, 3 symptoms from the table B, and 1 from the table C in order to have a diagnosis of a hyperkinetic disorder. However, in DSM-4, we should have 6 symptoms from the table A and 6 symptoms in total from tables B and C in order to have a diagnosis of the combined type. If you have 6 symptoms from the table A and less than 6 in tables B and C, we have diagnosis of inattentive type. Whereas if we have 6 symptoms in total in tables B and C and fewer than 6 in table A, we have diagnosis of the hyperactive type. However, in both measures, all the symptoms should be present before the age of 7, persistent for more than 6 months, and observed in 2 or more settings, impairing the social, occupation, or academic function of the person, and also be an indicator of asynchronous development. So maybe another question that comes to mind is why we have chosen the Vanderbilt ADHD Diagnostic Teacher Rating Scale. Other behavioralists, such as Corner Rating Scale and Child Behavior Checklist, are more broad-based, are not DSM specified, and have a different scoring system during the diagnosis process. However, SNAP, it was created based on DSM-3, the first one version, but also the SNAP-4, it is DSM-4 specified, but it has different scoring system. Also, we have to mention again that there are also comorbidities such as anxiety, depression, learning disorders, conduct and oppositional defiant disorders, and antisocial behaviors that also should be taken into account. So, we have chosen this tool because it's very simple. It contains the 18 core ADHD symptoms DSM-4 specified, and some extra symptoms for comorbid situations. So, we have designed this mobile-friendly vocabulary that is 25 items, and it covers the 72% of both diagnostic tools that are the DSM-4 and the ICD-10, and 60% of the Vanderbilt ADHD Diagnostic Teacher Rating Scale. Our next steps is, of course, the evaluation of our vocabulary, our screening tool, and we are hopeful that the results will be encouraging in order to disseminate the use and the efficiency of our vocabulary. And also, it would be a great pleasure for us to add this vocabulary to the ONE project, because we're inspired by this project, and we want to facilitate both the child's observation and the widening of the child's network. Here the literature, and thank you very much.
Okay, we thank Niki for the very concise presentation of a rather big topic. Do you have any queries? I have the impression that the way that the today's sessions are built up, we start up from the plenary session, which was very impressive, and I have enjoyed it personally very much. Then we go to the presentations of this session, and we build up a democratization of medicine. What we've heard in the plenary session, in the keynotes, from the keynote speaker, is that we are having a lack of money, lack of funds. And when we hear for democratization, that is, you have a very inexpensive tool that can be promoted to the mass public and used for diagnostic purposes, I presume the query that everybody wants to ask to the presenter is how reliable is this process, not the specific tools, in terms of medicine. That is, how do we imagine medicine the next years? Everybody walking up with his personal assistant? any comments on this?
Related to
Press the button.
this one? Yeah. Have to hold? Yeah. Okay. My question is related to the use of this mobile device application in the different context. I mean, how much teachers are keen to adopt this mobile application during the lesson or during the normal activities, because usually these child are included in a normal class. They are not following a specific course. So I think that we have also to consider the grade of willingness of the teacher in adopting these technologies. So.
Okay, thank you very much. Please take a seat next to Davide.